in your website, you focus hugely on reversal, and in fact, you take pride in your institute's sort of drive to reverse or put into remission type 2 diabetes. And then you also help people with various pains. And I was just going to ask you what the link between those two conditions is, if at all there is a link.
Yeah, so it's really chronic disease. That's the generic term, which is $1.7 trillion in U.S. healthcare expenditures. About 2/3 of healthcare expenditure in the United States is related to metabolic inflammation, and it's associated with type 2 diabetes and obesity. And what we spend our time doing is getting that reversed. The reason why we're effective at it, because your regular chances of losing weight or even getting somewhat healthy is about less than 1%, one chance in 167 to one chance in 230 or 214. In our institute, we're running about an 80% effectiveness, 8 out of 10. The reality is that I'm in a different situation than most people, because people come to me not because they think they're overweight. They don't come to me saying, hey, I think I have metabolic inflammation. They come to me initially because they have severe unrelenting pain, or they have an addiction, or they have a PTSD, or they have some other clinical manifestation that really bothers them. And it's the equivalent of kind of taking the thorn out of a lion's paw. If you saw my presentation, one of the first slides that I showed was a picture of Androceles. It's the Greek slave Androceles who plucks the thorn from a lion's paw, and forever that lion is his friend. And so for me, I'm able to convince patients, hey, look, you have this chronic pain, you have this addiction, you have this other disease process, but underlying this, there's a reason why you have it, and here it is. And then using that, I'm able to change their paradigm and get them to understand true metabolism and start to reverse that. So my average patient comes in and they're on 90 to 140 milligram morphine equivalent. My average patient comes in and they're on an average 200 pounds overweight. My average patient comes in, and by average, I mean 99%. And so almost all of them are uniformly ill, and they almost all have more than 3 disease processes, and they almost all have processed food addiction. And so we're able to unwrap those issues and unwind a lot of those and get them to feeling better and get them to wean off their pain medications, fix their underlying anxiety, depression disorders, and start working on their weight. And it's not that we're doing something magical, but we're able to focus in on the paradigm that's causing their problem and really assist them in that. And so that's how we kind of are all together in that kind of issue. That's why it for me, it's very synergistic. It's more of a holistic approach rather than just fixing their pain or just fixing their diabetes. And I have an advantage because the patients that I have are in pain. They're not just regular patients. They have chronic pain. They have polyjoint arthralgias.
So what are some of the pains? If can we go, can you give some examples? What are some of the pains that people come to you with? I think migraines is one.
Yeah, we certainly deal with a ton of migraines, but the most common pain people come, and it's 2/3 of all US patients and probably 2/3 of British patients as well. The most common pain is low back pain and neck pain that prevents functionality. And that's the most common. And they usually have tried non-steroidals. They've tried paracetamol, or they've tried Tylenol, or they've tried medications. A lot of them have been put on other stronger medications. Majority of them have been tried on opiates, and they didn't work out. A lot of them have been to physiotherapy or physical therapy. Almost all of them have. And the average patient's had symptoms for years. And it gets to the point where it affects their day-to-day activities. And it ends up at the point where they end up with sleep deprivation. And once you get into this doom loop of disturbing your sleep, lacking restorative sleep, once you get into the endocrine effects of lack of sleep, where you lose your testosterone, you start to get cognitive impairment. Your job function starts to go down. You start to have more difficulties in your family. Statistically, patients with one member who has chronic pain, the whole family unit drops by at least one standard deviation to the norm on financial household income for the entire family unit. And so there's a higher divorce rate, higher job loss rate, higher economic deprivation rate. People go from owning a home to ending up renting a home. They go from renting a home to end up being homeless or having to co-share. And so there's an economic impact that's sequential. And so that's the medical end of my life, is dealing with that. But if in that you catch a little whiff of economics, because I have a background in finance, and I've always been fascinated by how financial systems work. So I went off and got an MBA in finance, and I ended up wanting to analyze cross-border issues. So I ended up getting a degree in international finance. It gave me the understanding of metrics, and it gave me the understanding of creating financial models. But I wanted to see compared to what, just because it's in the US or just because it's in a westernized country, how does it compare to a non-westernized country, and how does it compare to other areas? And so I always have this approach where I compare what's going on here in the US to what goes on in China, or what goes on in India, or what goes on in South Korea. So I'm always curious about what those other issues are.